name is Kenisha Lee, and I'm presenting a plan to establish a diabetes slash hypertension specialty clinic in Katy, Texas. The diabetic hypertension clinic will be located within a modern, state of the art medical facility in the heart of Katy. The clinic will occupy a dedicated wing with ample space for exam rooms, patient education areas, and a comfortable waiting area. Our clinic is all about delivering top notch healthcare to individuals dealing with diabetes and hypertension, aiming to really make a difference in their lives. We put the community first, making sure everyone can easily get in touch and feel welcomed in a warm, friendly environment where every patient matters and feels secure. Our team is filled with devoted experts who provide personalized care designed to meet the unique needs of each person walking through our doors. Our mission, you ask, is to positively influence our patients' health and happiness, giving them the tools and support they need to live better, healthier lives. At our facility, we will be taking care of patients with hypertension and diabetes. We will be focused on three main areas, which are preventing, managing, and educating adults about diabetes and hypertension that are 18 years and older. So here's how we're going to tackle this. First, we have to figure out what's going on. We start with a thorough checkup to figure out if diabetes or hypertension is present and how serious it is. Then we tailor made our care plans to each individual. Every person is unique, so we craft care plans that fit just right, targeting your specific health needs. We also have dietitians and nutritionists that are here to guide you through creating a diet that's balanced and supports your health goals. And we will also keep track of what's going on by catching potential problems early with regular screenings and checkups so that we can tackle them head on. With our telemedicine services, follow ups and consultations are just a video call away, making it easier to manage your health on your schedule. We're here to support your journey to the healthier life and personalized care at every step of the way. This slide actually goes more into detail of the comprehensive care approach, where it shows the personalized treatment team for each individual depending on their needs. The integrated therapies, which the clinic combines evidence based medical interventions with lifestyle coaching, nutritional guidance, and emotional support. There's also continuous monitoring where patients receive regular check ins, lab tests, and remote monitoring to track progress. And then there's also collaborative care where the multidisciplinary team works closely with the patients, their families, and primary care providers to ensure seamless coordination and communication throughout the care journey. When it comes to our staff, our clinic will boast a specialized medical team equipped with a high level of expertise to ensure comprehensive care for our patients. Our dedicated team includes an endocrinologist who specializes in treating diabetes and managing hormonal imbalances, offering expert advice and treatment options to manage diabetes effectively. We also will have a cardiologist on board who will focus on heart health. Our cardiologist is here to manage and treat hypertension and related cardiovascular conditions, ensuring your heart remains strong throughout the process. We will also employ a nutritionist who is essential for guiding patients towards healthy eating habits. Our nutritionist designs personalized diet plans that support the management of diabetes and hypertension, contributing to overall well being. And so, to ensure each patient receives attentive and personalized care, we have assigned 3 nurses to each physician. This high nurse to physician ratio allows us to provide focused and efficient care, ensuring that all patients' concerns are addressed promptly and thoroughly. With our team of specialists and dedicated nursing staff, we are committed to offering a holistic approach to managing diabetes and hypertension, empowering our patients to lead healthier, better lives. The employment contract for our specialized medical team will include a competitive salary and benefits package That includes health insurance, retirement contributions, and paid time off for a 2-year contract that can be renewed yearly. We also have growth and development opportunities, flexible work arrangements, and performance based incentives. Our employment agreement is crafted with the well being and satisfaction of our employees in mind. It will guarantee equitable compensation, ample time off to foster a healthy work life balance, which everyone needs, opportunities for professional development, legal protections, and a reciprocal commitment to the success of both our employees and the organization. The contract outlines the terms of employment relationship between the clinic and the nurse practitioner, defining the duties, expectation, and benefits associated with the NP's role within our healthcare organization. The agreement is effective for an initial term of 2 years from the commencement date, and upon those 2 years, the contract is subject to review and potential renewal based on the performance evaluations and mutual consent. The NP also commits to practicing under the Texas Board of Nursing scope of practice guidelines and adhering to the specific policies and procedures and standards set by the Texas Board of Nursing. The work schedule will include a Monday through Friday work week from 8 to 5 with an hour lunch that is included from 12 to 1 p.m. or 1 to 2 p.m. daily. The NP must dress appropriately in business casual attire or including a lab coat, or they can prefer to wear scrubs if acceptable. The flexibility allows for the professional appearance while accommodating personal comfort and practical aspects of the environment. When establishing a medical care clinic, it is essential to have close collaboration with the nearby doctors in order to be able to offer patients a great medical service. So here's how we'll do it. Fostering solid partnerships with local physicians is key to delivering outstanding health care. By prioritizing clear communication, mutual respect, and cooperative arrangements, we aim to enhance the well being of our community together. We also can implement mentorship programs where early in the tenure we can pair APRNs with experienced physicians and senior APRNs for mentorship. We can establish clear communication channels where we can use digital platforms for securing messaging and consultations to ensure that the APRNs can easily reach out to physicians or PAs for advice. We can organize regular case review sessions where APRNs, physicians, and other healthcare professionals discuss complex cases. We will also encourage and support ongoing education and professional development for APRNs and physicians alike. But it is also very imperative that we establish a feedback friendly environment where team members can give and receive constructive criticism and constructive feedback. To ensure patient safety, our clinic follows strict guidelines and procedures. These include clear patient care rules, understanding our scope of practice, emergency protocols, and adherence to best practices. Our APRN protocol agreement is a crucial document that shapes the collaboration between physicians and APRNs in our clinic. It requires an active mutual endorsement and is up for review and renewal annually to ensure it stays relevant and effective. The agreement gives APRNs the authority to prescribe certain medications under specific conditions, with more freedom granted for Schedule 4 and 5 drugs than for Schedule 3, which is at the physician's discretion. To ensure strong communication and alignment, the, the agreement mandates face to face meetings at least monthly, with an increased frequency to bi weekly during the first 6 months of collaboration. Furthermore, the clinic commits to providing all necessary malpractice insurance for APRNs, adding a layer of security and support. Yet it emphasizes the importance of oversight as APRNs are not permitted to perform procedures independently until they receive explicit approval from a physician. This framework not only ensures patient safety and high quality care, but also fosters a supportive, collaborative environment for our medical staff. We continuously assess our performance to ensure we're operating at our best. This includes checking patient outcomes, gathering feedback from patients, evaluating our team's effectiveness, and learning from mistakes to improve care. Ways that we can assess and evaluate APRNs is by offering APRNs opportunities for additional training and certifications that could broaden the scope of conditions that they manage, enhancing clinic service. We also can implement a structured system for tracking and documenting the proficiency of APRNs in various procedures, ensuring clarity on what each APRN is qualified to perform independently. Our financial strategy lays down a detailed blueprint for getting our diabetes hypertension specialty clinic up and running in Katy. It spells out the cost involved, how well how we'll make money, and our financial expectations to keep the clinic thriving for years to come. In setting our prices, we've been really thoughtful. We want our services to be affordable for our patients while making sure the clinic can keep its doors open. After looking into what other clinics charge and considering the top-notch care and specialized services we're going to offer, we believe we found the right balance. Looking ahead over the next 3 years, here's what we're aiming for. Client numbers and visits. We're expecting to see more and more people walking through our doors as the clinic becomes a staple in the Katy area. This optimism is grounded in the growing need for our services, how well we're getting the word out, and our efforts to be the go to clinic for those managing diabetes and hypertension. We're projecting that our income will grow along with our client base thanks to our pricing and strategies we have in place to bring people in. We're all about spreading the word and partnering with other healthcare pros to make sure we're not just another clinic, but a vital part of the community's health. This slide actually just focuses on resource requirements that may be needed when starting up a medical clinic, which requires capital equipment, fixed supplies, and variable supplies. In conclusion, our Katy, Texas Health Center is dedicated to offering comprehensive support and guidance to patients dealing with diabetes and hypertension. By collaborating closely with local physicians and incorporating our management team and staff, we pledge to deliver superior healthcare services and elevate community health standards. Embracing continuous improvement as our fundamental ethos, we are committed to actively listening to our patients, learning from errors, and seeking ways to enhance our services further. Building a healthy community requires active engagement in three key areas: addressing individual health needs, fostering collaborative efforts, and making a direct positive effect on, a positive impact on people's lives. Together, we are confident in our ability to make a significant difference in the lives of those in Katy and surrounding areas who are battling with these health challenges. And thank you for listening.